This is BayCare Health Chat, another podcast from BayCare Health System.
Welcome to BayCare Health Chat. I'm Caitlin White, and in this episode, we are discussing toxins and poisoning with Dr. Ibrahim Karkovandian, an emergency medicine physician with BayCare Health System. Doctor, do children get poisoned with the same agents as adults?
Not necessarily. Depends on the age. So the toddler are very curious, and everything quickly goes to their mouth. It's different than comparing, for example, the pediatrics to the adult. Usually they are unintentional. It means they are by mistake they put something in their mouth, or the parents, as I mentioned, give us Tylenol more than recommended dosage for the fever, or give Advil more than recommended dosage. So those are, we call them unintentional in pediatrics, usually unintentional overdose. But when it comes to the adult point of view, mass majority of the adult poisoning are intentional. What it means, either they are trying to ingest the medication or use the drug to harm themselves and or to kill themselves. So that is a different medication and different way they get exposed. In the pediatrics, vast majority of the overdose or poisoning happens at home. These are the household products. These are the medication at home. When the parents leave the medicine over the counter, they forget, or grandparents have the blood pressure medication, for example, they leave them on the table, then the toddler or the kids get hold on that and put them in their mouth. But the adult, on the other hand, as the adult usually, as I mentioned, could be from the recreational, means using it with high, use the intravenous drug, illicit drugs, street drugs. Under this adult could be also the elderly individual, because the elderly have a poor vision sometimes. Some of them are forgetful. They mix the medication, blood pressure medication together, mix them with the vitamins, and they accidentally get overdose. So those are also called unintentional.
So what is the most common poisoning in adults?
The most common cause of the poisoning in adult overall is going to be analgesia. Analgesia, we are talking about the most likely are street drugs. Street drugs, we are talking exactly like a heroin or any of those other fentanyl or illicit drug on the street. These are the most common cause of the morbidity and mortality in the adult overdose.
Talking about overdoses, how many drug overdoses are reported to the Poison Control Center annually?
Annually, we used to see very close to 2.5 million drug overdose phone calls made to the Poison Control Center. But over the last 4 to 5 years, the trend has been lower. It means about 2.1, 2.2 million. But surprisingly, in 2019, which is the last year, the data of last year is available to us, we have over 2.5 million phone calls made to the Poison Control Center regarding possible drug overdose. Out of those, they had about over 2 million of those calls were involved the human, and about 70,000 of those calls were made in 2019 regarding the animals. And the dog, by the way, the dog being a number one, accounting for 90% of the animal exposure to the poison, or dogs, account for 90% of all the animal calls poisoning to the Poison Control Center. Some other calls to the Poison Control Center are for obtaining information, for example, from the pharmacist or drug interaction. But the important thing is the most of the calls are made to the Poison Control Center come from home like yourself, like myself. We have a concern, we have a question about the drug, we are a child or accidentally get exposed to the medicine or drug or the chemical. So the vast majority of the calls come from home. There is a Poison Control Center in the hospital. They have an 800 free number, 800-222-1222, which as soon as you dial that toll-free number, you are connected to the local Poison Control Center. So what they do at the Poison Control Center, they collect, these are confidential by the way, They collect the information, and the toxicology specialists, they call them poison specialists, which are the nurses and the pharmacists work at the poison control center. So they obtained all the information and they present it to the toxicologist on call, and then they give appropriate direction, either to go to the hospital or stay at home and just watch, or for example, this particular medicine is not poisoning, you can just watch them at home. So the poison control center are 24/7, available in any part of the United States, and all have the same 800 number. I'm going to repeat, is 800-222-1222.
Well, wrapping up here, Doctor, is there anything else you'd like to add about toxins and overdoses?
Yes. At the end, my recommendation, again, for the parents are a few things. Number one, do not mix the household product, cleaning product together. Do not mix the ammonia and the bleach together. And also, when you are using the chemical at home, please put the gloves on, put the mask on, turn on the fan, open the windows. Just going to be very careful. And then number two, I'm going to recommend, keep all the chemical out of the reach of the children, and also keep them on the original containers. Do not put, for example, the chemical to the soda can or put a milk container. Just keep them in the original container and make sure they are tight in the container. Also, try to put all the medication, including over-the-counter medication like a Tylenol, aspirin, out of the reach of the kids. Put them in the cabinet. Make sure they are in the secure area that they cannot get hold on that. And of course, we talk about the Poison Control Center 800 number. It is a toll-free. It doesn't have to be an emergency. If you have any question, any concern, just give them a call. There are specialists over there. They answer the question. They follow up with you. This is what the job. This is what we do. This is what we are at the Poison Control Center for questioning. As I mentioned, vast majority of the calls to the Poison Control Center are basically regarding the drug overdose or drug interaction are treated at home. They don't go to the hospital. Vast majority, up to 84%, are treated at home. We just tell them to stay at home, they watch for this and that. Then if it's a complication, they advise them to go to the hospital. So please do not forget, put this under your refrigerator. This 800-222-1222 is a toll-free number, confidential and available at anywhere in the United States.
Well, thank you for this information, Doctor. Head on over to our website at baycare.org for more information and to get connected with one of our providers. Please remember to subscribe, rate, and review this podcast and all of the other BayCare podcasts. For more health tips and updates, follow us on your social channels. This has been another episode of BayCare Health Chat. I'm Caitlin White. Stay well.